To assemble the aspirating syringe, I will follow 3 steps. The first step is to insert the cartridge, second, engage the harpoon, and third, to attach the needle. After opening the sterile syringe, pay close attention to making sure that it is in good working order. Nothing should be loose or bent. The thumb ring and barrel should be tight. Before inserting the cartridge, be sure you are using the anesthetic of the doctor's choice. Make sure to check the expiration date. There are no bubbles, cracks, or discoloration in the tube. To insert the cartridge with one hand, pull back on the piston rod with your thumb to make room for the cartridge to fit into the barrel. Place the cartridge with the diaphragm end towards the threaded tip. Now we need to engage the harpoon into the rubber stopper. Hold the syringe with your non-dominant hand between your thumb and forefinger. Be sure your hand is parallel to the floor. Carefully give it one good whack over the thumb ring. If successfully attached to the harpoon, as you wiggle the cartridge side to side, you should see the thumb ring swivel. Finally, I will attach the needle. Carefully twist the protective cap off the stylus, which is the short end of the needle. Place this end into the threaded tip and through the diaphragm. While slightly pushing inward, twist the needle clockwise firmly in place. The syringe is now ready for the doctor to use. After the patient is seated, the licensed dental assistant may apply topical anesthetic to the specific area where the injection will take place. Always explain to the patient the procedure beforehand to relieve any anxiety they may have. We will need a 2x2 gauze, cotton tip applicator, mouth mirror, and ointment. Open the cap and use the applicator to scoop a small amount. Replace the cap. With a 2x2 gauze and mirror, gently dry the area. Place the applicator with the ointment to the specific site. Leave in place for a minimum of 30 seconds and up to 3 minutes for maximum effect. Before the dentist starts the injection, remove the cotton tip applicator. At this time, the syringe may be transferred to the dentist. Just below the patient's chin, using your left hand, place the thumb ring over the dentist's thumb. Hold the syringe firmly until the dentist's fingers are positioned on the finger grip. Then carefully push inward slightly while using your thumb and forefinger to pull off the needle guard and put it in the receiving device. After the dentist administers the anesthetic, she will place the syringe back into the receiving device. To disassemble, while pushing the needle towards the threaded tip, turn the needle counterclockwise. Carefully pull out and place into the sharps container. With your thumb, pull back on the piston rod, slide the cartridge out onto your palm. Place it onto the patient tray. Do not discard yet until you document what and how much anesthetic was used.